For the Britain Health and the People course, otherwise known as Medicine Through Time, there are 3 8-mark questions. Okay, I'm going to take you through each one, give you a couple of examples. You may wish to pause the video to see my answers and to look closely at them. It's a really good idea because I won't leave the screen on them for too long. I'm also very happy to email you those answers as well. I have emailed, I think, most of you, or all of you really, but if you've lost them, I can email you the answers that you can look at as well. So you have a really clear idea of how it is you answer these 3 questions. What are they called? They are called how useful questions, and they are about primary sources. Primary sources are sourced from the time you wish to study. The second one is known as an explain the significance question. The third one is a compare question. They are all 8-mark questions, and they should take you about 10 minutes each. You'll have a little bit of leeway, a little bit more, but about 10 minutes. So let's look at the first one. The first one is called a how useful question. It is a primary source question. Primary source, a source from the time you wish to study. Basically, medieval source, the 19th century source, but it's from the time. First piece of advice, look closely at the question. It will ask you to look for something specific within the source. So that's really important. Underline those key words. Secondly, I would say it's really important that you focus on why it is useful. Don't say all the reasons why it isn't useful. Yes, you can mention that, but the most important thing is to say why, as a historian, this is a valuable source. Thirdly, you will need to use your knowledge to explain what the source is telling you. That means that when I say contextual knowledge, it's knowledge about what was happening at the time to explain what the source is telling you. And the final thing is you need to think about the provenance and the purpose of the source. So you need to make a comment on, well, who wrote this source and why does that make it useful? In what way does that make it useful to a historian? When was it written? What was the person trying to achieve when they made this source? Okay, that's really important. What's the purpose? That doesn't mean you can dismiss it just because it's no good just saying this source is biased. If it is biased in some way, we'll explain how, because that can make it useful anyway. So it's really important if you're going to use the word bias, you say how. Okay, those are the things I'd like you to think about for that how useful question. Now I've got some examples here. I've taken these from the book. So what you can see here is the one which is how useful is this source for the understanding of the development of surgery. So they're looking for you to look at the source and say, what's it telling you about the development of surgery? So it's a painting, and it usually gives you a bit of bump. And here at the bottom it says it's a painting from the 17th century, so the 1600s, showing a foot being operated on before anaesthetics were available. And here you can see the mark scheme, always divided into 4. You can show understanding of the source, you can get a couple of marks. Everything above that is about the amount of knowledge you're able to use to explain the source, how good your comments are on the provenance and purpose. Okay, and if you can do all of those things well, you can get right up to it. Okay. So how do I go about this question? And again, it's always worth pausing occasionally on the video to think about what I'm trying to say here. And I've put it on the slide as well so you can see. So the first thing I would say is explain what the source tells you about surgery. That's how you start. Then I would use my knowledge to explain the source. And, you know, maybe you could also argue why it doesn't, you know, what it doesn't tell you, what it leaves out perhaps, or even if it's got something wrong. But I would particularly focus on just explaining what is going on here using your knowledge. Refer to the provenance and purpose. Then finally, overall, how useful? In what way is this useful? Now, the easiest thing for me to do is to show you my answer. Okay. So here's my first bit. My first bit is all about what is the source telling me? Well, I think this tool, I'm going to keep that relatively simple. In this case, I'm going to say it shows me that surgery was very basic and it was based on limited scientific understanding. Okay. Now, I might, in an ideal world, I could then just give some specific reference to the painting itself. So I could say, and maybe I could have improved it by saying something like, well, he's got his foot on a table and he's in his own home, something like that. But it doesn't matter in a sense because I'm going to just sort of develop that in my next bit. So this in green here is all about my contextual knowledge. And this is where I'm using my knowledge to explain what I see. This is probably a barber surgeon who would have had very little training, and in the 1600s, all surgery would have been carried out with limited pain relief. So can you see that there I'm using my knowledge to explain the context this picture here. It appears as if the patient is having an amputation, which was the most common form of surgery. And again, I don't know that, but it's okay for me to take an educated guess and then to use my knowledge. As anything more complex would have taken too long, would have needed more thorough understanding of the human body, as well as pain. Patients like this would have had also pain through infection, and we can see here that the surgeon is in a house, not wearing sterile clothing, as doctors did not understand the role bacteria played. So I've used lots of knowledge there to explain the context, the background to this picture, okay, to explain why that is a useful picture to an historian, showing us all of these things. The third thing then I'm going to do is talk about the provenance, and I've highlighted that in the blue and I've made it a little bit bigger so you can see in the purple. And I've made my assumption here that the artist is probably trying to reflect the nature of surgery at the time, but it gives us a useful insight. You know, there's no reason to think that he isn't trying to show us something about what it was like for people to undertake a medical process. But I would also say there's a limit to its usefulness, because it really only shows us it shows us some things about surgery, but it doesn't show us that actually by this point there were surgeons such as Paré developing new treatment, and I think because the other thing I would say is probably limits its usefulness, things about the development of surgery. And this shows us a point in time, and actually, of course, what we know is that by the 1800s there were huge strides forward in the role of surgery. So it's okay if you want to reflect on why it's limited in some ways, but generally I focus on why it's useful. My final bit here then is I've said it's really valuable if we're trying to understand what the development of surgery at this point in the 17th century, when there was limited understanding, but it doesn't help us to understand the development post that, particularly in the early 1800s. So I've got those four bits there. What's it telling me? Contextual knowledge, provenance and purpose, and then an overall summary. And that's the kind of structure you want to follow it ideally. You can't do it all, then you should at least say what it's telling you. And you should either be able to try and say something about the context or perhaps the provenance and the purpose. Okay. Now, this is the answer altogether, which I can send you. You can pause it on that screen if that would help, or the other one. Here is another one you did for me. Exactly the same process. There is the answer. I'm happy to email that out if you can't find it. And you could pause it on the screen and have a look. But I'm doing exactly the same process there in that question. In this light, it's about the Black Death, and it's another painting. And I've done exactly the same thing. What's it telling me about the impact of the Black Death? How can I use my knowledge about the Black Death to explain what's going on? What can I say about the provenance? It's, you know, a history book written by a monk. You know, why was he writing it? I've said something about that, and then my evaluation. So that's those two, and you can pause it on that screen if you wish, if that would help you. Have a look at both those answers. Now the next one that you get is an explain the significance question, and what you see there is the mark scheme. And here, for explain the significance question, you've got to, it's going to ask you, why was a person significant in the history of medicine? Why was an event significant? And what you're really trying to think about is why this person was significant in the short term, i.e. when they were alive or at the time of the event, and why they were significant, or the event was significant in the longer term, short and long term, or short and long medium term. You're thinking about those kind of things. Ideally a paragraph for each, and then possibly even a conclusion as well. And I'll show you again an answer on how I do this and what you should be thinking about. Okay. Look at the mark scheme there. You can see that if you can just say maybe one reason it was important, or two, you can get some very simple mark, get sort of the lower marks, but still important. The more you're able to fully explain long or short term, the better your marks are. Okay, and get to that level 3, you've really got to be able to try to explain a short and a long term, if you can, impact. Right. What's my example? My example, you see the question at the top there, is one I asked you to do last week, or 2 weeks ago, and it's explain the significance of Lister's work for the development of medicine. And what am I doing here? Well, the first thing I'm doing then is I'm going to show you why Lister, or show the examiner why Lister was important in his lifetime, why he was significant in his lifetime. I said there, one reason he was significant is he took Pasteur's germ theory and he applied it to his own work, because he recognized that this chemist, or this French chemist's work could be applied in the operating theatre that he was working in, and he and his colleagues were working in. And he recognized that bacteria could get into open wounds during an operation. And so he was significant because he took steps, having recognized that, to fight infection. So to combat this, he used carbolic acid on patient dressings and on surgical equipment to kill germs, known as antiseptic surgery. This had a significant impact on reducing deaths from infection. Only 15% of his patients died after this method, compared to nearly 50% before. So I showed you at the time he had a big impact on surgery in his hospital at the time. He was important. That was why Lister was important at the time. Now, the next thing I'm going to do, and it's in green, and I've highlighted it with slightly bigger size here, is I've then said, why was he significant in the longer term? And again, I think there it's because he raised the profile of germ theory in Britain over the longer term, medium and longer term. And he's one of those people that helps establish it over the following decades, germ theory, that is. And now, of course, we completely accept the role that microbes play in infection. And he, in that longer term, then he is one of those pioneers that helps create the sense of acceptance in the 19th century, and now, of course, we totally. So he has both short and long-term impact. Okay. My last one here is then, this is my judgment, which can be quite a bit tricky. The most important thing is to focus on those short term, and then medium stroke long term impacts. That can get you 6 marks if you do that well. Get those top 2 marks. What you're trying to do is some sort of judgment. And if you look at mine, I'll hopefully explain what I'm doing. Whilst many important scientists disputed Lister's findings when he published them in the 1860s, his evidence was used in combination with other scientists to prove patients. Along with pain relief, the discoveries made about the role of microbes are incredibly important in allowing surgeons to carry out more complex operations safely. So I've combined and I've showed that the work he did at the time had longer term influence and had a massive impact on surgery in Britain in his lifetime, but more importantly in the longer term. So I've done my summary statement, and that will get me those full marks. I've done the same here for explain the significance of William Harvey in the development of surgery. So another important character from a bit earlier on. I'm not going to read this, but you can pause it, you can look at my answer, and you can see I'm doing the same thing. One way he was important during his lifetime was, second paragraph, his discovery was incredibly important in the longer term because, and then my summary judgment. So I've done those 3 paragraphs, exactly the same process. Now the last one is your compare question. And for this, you've got to compare events or people on ideally 2 issues. And what it's going to ask you, it's going to ask you to say why they were similar or why they were different. And ideally, you're looking for 2 similarities or 2 differences. Again, ideally with a concluding paragraph if you can. And here is my mark scheme. 1 similarity could get you up to 4 marks. 2 done well can get you 6. That's where that's the key. That's the really important bit. Judgment paragraph at the top. And the one I've done here, and the one I'll talk about briefly, is comparing the work of Pasteur, which is what I asked you to do last week or the week before. And this question was, how are they different? It could be similar, it could be different. So I've said, be really clear from the start. One way in which they were different was that Pasteur was not a doctor, whereas Koch trained as a surgeon. So there's a real difference. I'm going to explain why that's important. This meant that Pasteur's initial work on germ theory was not based on patients on food and drink. And from that, he gets the process of pasteurization. Koch, on the other hand, was exclusively built on Pasteur's work, but focused exclusively on human health. So I've said how they were different. Pasteur worked on both. Koch was very much focused on the bacteria and microbes and their effects on humans and developing vaccination. So they were different in that sense. I've got another difference there. It's in green, in that I've said another way they were different was that Koch focused his attention on identifying which specific microbes caused certain diseases. He developed a number of new techniques for these, including use of dyes and photography, which led to new discoveries such as the bacteria responsible for anthrax. Pasteur, however, used the work of Koch to develop new vaccines for diseases, and was the first one to develop a vaccine for anthrax. So what I've said there is that Koch was very much focused on thinking about ways he could identify the specific causes of certain diseases, the specific microbes that related to specific diseases, which was slightly different from Pasteur, whose focus was on the developing vaccines. They both developed vaccines. Now, you could get a question which was, how are they similar? And that is also true, because in one way you could say they were similar, probably a bit in it, say that they were both involved in developing vaccines, but the question asks you, how were they different? So you've got to look at how they were either different or similar, depending on what the question asks you. And then I've said both men had a significant impact on the understanding of microbes playing infection and the development of vaccines to combat disease. Pasteur, however, was a chemist as well as a biologist, therefore his work had wider uses, whereas Koch was specifically focused on the human body. So I've summarised again, I've made my... Now, I've done exactly the same thing there, by the way, is the question written out with the mark scheme above it. I've done exactly the same thing with the Vesalius and Hunter here. This one is about similarity. And so there I've done a paragraph on they both used, I've explained they were similar because they both studied the actual human body. And then I've done another paragraph saying they both were similar because they both promoted their ideas through lectures and books. Probably a slightly easier question, that one. Again, have a look at it, look at what I've written to see the process I'm following. We've obviously got the judgment at the end. Okay. And there is the question. So that is my little guide to how to answer these questions.